Value-based care is a broad term used to describe a healthcare model that adds more value to the care provided to patients. But what does that really mean? In this video, we'll take a deeper look by exploring 4 key objectives found in the various value-based care programs, so you can get a better understanding of value-based care and how you can implement it at your practice. Hey there, this is Dan from ThoroughCare. At ThoroughCare, we've helped streamline value-based care for clinics and physician practices all across the United States with our care coordination software. A lot of you, particularly those who work in clinics and provider offices, have been hearing about value-based care, and it can seem intimidating. For the longest time, providers have gotten paid for providing a service to a patient. But value-based care programs are designed to incentivize healthcare providers to deliver a higher quality of care, as opposed to quantity. So this is a transition to providing value to patients and tying those to reimbursements for performance metrics. There are many different value-based care programs: shared savings, capitated rates, bundled payments, hospital readmission reduction programs, words like MIPS and MACRA you've probably heard of. There are many types of incentives to encourage groups to transition away from the fee-for-service model to these new models. Now, we're not going to go into all the types of value-based care programs, but instead, we're going to look at the trends in all the programs. So regardless of which program your organization might be thinking of joining or becoming a part of, we've seen 4 unique trends or objectives across all of the programs. So let's look at these 4 objectives that we've recognized across all the value-based care programs. The first objective is lowering patient costs and improving outcomes. By providing preventive services, the plan is to keep the patient away from high-cost services, like going to the emergency room and being admitted to the hospital. By taking active steps now and being proactive, patient cost goes down and health outcomes go up. The second objective is to increase patient engagement and satisfaction. By staying in contact with your patient, creating a care plan, finding health goals that your patient can relate to, not only will you improve health outcomes, but you'll improve that engagement between your staff and the patients. And when that happens, patient satisfaction increases as well. The third objective is to reduce readmission rates and reduce risk. As I mentioned in objective number 1, by keeping the patient out of the hospital, where it's really expensive, the patient avoids those serious health issues. So by providing these proactive services, the patient's overall health risk, especially with their chronic conditions, is significantly reduced. The fourth objective is better overall health of the population. We talked about examples of managing individual patients, but if these programs are applied across your organization, your overall patient population health improves. This is not only good for all of your patients, but it's good for your practice, your patient satisfaction, and your quality scores. If you do any of the value-based care programs, a successful program would be achieving these 4 objectives, and being able to demonstrate this can lead to improved reimbursements. So, how can you go about achieving these objectives? In the following series of videos, we want to share our thoughts on how you might be able to achieve these 4 objectives. You may be familiar with preventive care management and wellness programs that already exist today. CMS has been pushing these programs for years to incentivize you. These programs can be tied into how you begin to implement value-based care. Remember, these programs include chronic care management, remote patient monitoring, annual wellness visits, transitional care management, and behavioral health integration. We invite you to learn more about these programs by watching this series of videos. Or if you'd like to learn more about implementing value-based care, please visit our Learning Center or contact us. There's links in the description below. As always, if you found this video helpful, please like it and subscribe to our channel. Thanks for watching. Bye.